Introducing a new groundbreaking technology in bladder management when using a Foley-style indwelling catheter. We are Infinity Medical Engineering. Dr. Frederick Foley invented the balloon-style catheter in 1936, making the quality of life for spinal cord patients, surgical patients, and people with severe bladder abnormalities better around the world. Since that time, little has been done to change or improve bladder management in respect to using the Foley catheter. Although the Foley-style catheter has saved millions of lives and made bladder management possible where it was not manageable before, it has also brought with it a number of adverse side effects that, until now, have remained managed only through large doses of antibiotic medications and very painful bladder installations. These adverse effects include urinary tract infections, bladder atrophy, bladder spasms, loss of bladder volume, odorous leakage around the catheter, and encrustation around the catheter tip, resulting in blockage and traumatic catheter replacement. Here we see a bladder with the insertion of a Foley-style indwelling catheter. Notice that the urine begins to exit the bladder upon entry due to forces of gravity and pressure within the bladder. In a matter of 48 to 72 hours, the bladder will begin to atrophy, and a stagnant pool of urine will form in the bladder to the level of the drainage outlet. This stagnant urine cannot dilute or agitate, causing the pH balance in the bladder to increase, along with a temperature of 98.6 degrees Fahrenheit or 37 degrees Celsius, allowing bacterium to form within the bladder. Bacteria and infection then travels through the ureter, finding its way into the kidneys and causes kidney infections, sepsis, and in approximately 10% of the cases, if untreated, will result in death. As an answer to these undesirable and sometimes fatal complications, Infinity Medical Engineering would like to introduce the Dynafill. The Dynafill operates using magnetic fluid valve technology, along with an innovative shape and pressure equalizing system, which uses Bernoulli's principles of applied physics to effectively and efficiently allow the bladder to fill and void in normal cycles. The Dynafill consists of an input and output chamber, a magnetic fluid valve, a micropore air inlet filter, and a sample port in order to take urine samples as needed. Once connected to the Foley catheter, urine will exit the body into the patent-pending Dynafill device. The magnetic valve chamber will then fill under the normal pressure of the bladder. Upon normal full bladder internal pressures, the magnetic valve will actuate at a specified angle, directing the flow of urine into the hydrodynamic-shaped output chamber. This will result in a vortex action inside the chamber, along with a small air inlet opening allowing air to mix with the urine, thus decreasing outward pressure force and increasing fluid flow velocity. The air mixture within the device will create microscopic bubbles that will keep the catheter tubing clean and prevent a biofilm buildup within the collection tubing. At a point where the upper and lower chambers equalize in pressure, the lower valve magnet will close, sealing the two chambers. The bladder will once again fill to a normal pressure and the cycle will repeat. This fill and void cycle will allow the bladder to function normally, even with the presence of the Foley catheter. The urine within the bladder will no longer have the ability to become stagnant, so it will maintain a normal pH and keep the patient hydrated normally. Bladder tone and volume will maintain normal levels throughout the fill and void process, preventing bladder spasms and bladder atrophy. The Dynafill, first of many innovative devices by Infinity Medical Engineering, will be available for market in 2014. For more information, please visit us on the web at www.infinitymedicalengineering.com.